I'm going to next introduce the rapid podium presentations. So each of the presenters has recorded their talks, and then they're going to be around for questions. So the first one is from Judith Gargaro, or Judy, and she is the project manager for the Neurotrauma Care Pathways Project, and she was program director for the Ontario Neurotrauma Foundation, the Acquired Brain Injury Program. And she focuses on neurotrauma care pathway strategies, especially for those underserved by the healthcare system. And she's going to present on development of a standardized pathway of care for patients after concussion in Ontario.
Our poster is entitled Development of a Standardized Pathway of Care for Patients After Concussion in Ontario. This work has been done as part of the Neurotrauma Care Pathways project led by Dr. Mark Bailey. I am Judy Gargaro, the project manager, and I want to highlight the contributions of Matthias Wiest and Olinda Habib Perez to this work. The quality and availability of concussion care varies across the province. Quantifying the size and impact of this problem is difficult due to non-standardized care pathways and the complex interplay between publicly and non-publicly funded care. Our aim was to develop an evidence-based standardized concussion care pathway for all Ontarians independent of mechanism of injury. We brought together a group of 100 stakeholders in a virtual summit to discuss neurotrauma care in Ontario. The stakeholders represented people with lived experience, clinicians, service providers, researchers, funders, service planners, and Ontario Health Quality. Working groups representing acute, rehab, community, and critical considerations met 28 times from November to March. Each working group reviewed published literature and developed building blocks for the ideal pathway of care for concussion, moderate to severe TBI, and traumatic spinal cord injury. The focus was on key elements of care, the what, not specific recommendations, the how, the role of clinical practice guidelines. For each of the working groups, building block discussions centered on, for acute, appropriate assessment and diagnosis, initial management, and transition planning. For rehab, appropriate symptom management, including reassessment and reevaluation, access to specialized rehab when needed, and ongoing follow-up by primary care. For community, follow-up, mechanisms for reaccess, and holistic support for patients and families. For critical considerations, social determinants of health, marginalized populations, mental health issues, and availability of caregiver support. Subsequently, we conducted focus groups and interviews with persons with lived experience to ensure that the proposed concussion pathway was addressing gaps. The simple pathway diagram highlights the importance of primary care, the need to reaccess care, and the integration of environmental and personal factors into care. The more detailed diagram shows the building blocks of care, highlighting that the number of building blocks increases as persons move from pre-acute care into the community, the importance of navigation, and the need for ongoing education and support for patients and families. We successfully brought together a diverse group of stakeholders who developed an ideal care pathway. Next, the group will prioritize implementation strategies focusing on regional realities and funding sources. Contact me at judith.gargaro@uhn.ca for further information. Thank you.
Great. And we're going to move on to the next poster presentation, which is by Dr. Alice Kam, who's going to talk to us about future direction of concussion education development. She is a physiatrist and also a specialist in medical education, curriculum development, and assessment. She completed her MD at the University of Manitoba and residency at the University of Toronto. She has a Master's of Science in Community Health. She's currently improving education for family medicine related to concussion. So I'll let the next presentation go.
Hi, everyone. I'm Dr. Alice Kam. I'm excited to be here today to share with you the future direction of concussion development. With the implementation of the Rowan's Law in 2021, there's an urgent need for physician trainees to acquire competency in concussion care. This is the concussion knowledge translation cycle that has been identified in Provendenza 2013. This is an important framework in terms of knowledge translation. Using this basis, our study searched 6 databases and 11 medical education journals to evaluate concussion education training for physician trainees. At the end, you find 6 articles. 5 of the 6 are United States studies. All of the studies focus on knowledge, the bottom of this pyramid. Regarding program evaluation outcomes, learners' performance and patient outcomes are lacking at this point. We use the same pyramid as program evaluation tool to construct our outcome-based training program. We focus on knowledge mobilization to benefit various stakeholders. We are 1 year into our study. We developed concussion study guide as well as YouTube videos to support our learners. The techniques identified in our study were further disseminated at CFD, Center of Faculty Development at U of T. This study is also supported by U of T with the Student Leadership Award. Many thanks for many of you contributing to the study to make it to be successful. Thank you.
Great. So on to our next poster, which is by Laura Langer on direct physician costs associated with the diagnosis and treatment of concussion in Ontario, a population-based study. She is an analyst at the C.E.T Research Institute at Toronto Rehab. She graduated from the University of Toronto with a background in molecular neuroscience and biostats. She has expertise in longitudinal cohort studies in neurological conditions. And she's the lead researcher of the Ontario Concussion Cohort and has written a clinical risk score, the tricorder risk for persisting concussion symptoms in adults. So I will let them start.
Laura, and thank you for visiting this poster. So we know that the Ontario Concussion Cohort identified that there are over 150,000 people diagnosed with concussion every year in Ontario. In the acute phase, these people should be followed up with their primary care physician to ensure that symptoms are not worsening and also to receive appropriate concussion care education. And long-term follow-up may be necessary for about 10 to 30% of people who continue to experience persisting symptoms. We wanted to take the Ontario Concussion Cohort and track the healthcare usage and also costs associated with it in 2 years following their concussion. And we have data available for everyone who was diagnosed between 2008 and 2014, which is a cohort of about 1 million people. Using the information that we have available through ICE's administrative databases, we're able to look at the acute care data and see that only 15% of people saw their primary care physician within 3 days of injury, and that the mean time between date of injury and first time they saw a primary care physician was about 21 days. The mean was 80 days, and there are some fairly substantial differences based upon geographical location, as shown in the graph. When we looked into follow-up care by specialists, 51% of the cohort saw at least one specialist with a mean of about 2.4 visits per person and a wait time of 238 days on average. Now, this did differ based upon age and rural location and also geographical location within the province, as you can see in the heat map and also the tables. When you looked into what specialists were referred out to, ophthalmology was the most frequently referred specialty, and neurosurgery and physical. And neurosurgery was the least. And when you looked into the number of visits per patient per specialty, psychiatry had the highest number of visits, around 9. When we calculated out using special macros with ICES that does a cost per person calculation based upon the OHIP billing database information, the average cost per person per specialist is about $300. Physiatry charges twice that. Once again, PM&R really standing for plenty of money and relaxation. Thank you guys anyway. And the overall cost per person for diagnosis, acute care, and follow-up, if any, is around $3,100 Total cost around $18 million per year. And there's also some differences based upon sex and rural location. So there is a fairly large problem in Ontario with the number of concussions and some substantial healthcare costs associated with it. And there are some access to care differences based upon age and region that should be addressed. Thank you again for visiting this poster.
And last but not least, I'm going to introduce Michaela Bubna and Olivia Scott, who are going to present on characterizing acute versus chronic concussion patients' profiles in Ontario. Michaela works as a research assistant at the Concussion Clinic in the Hamilton Health Sciences. She graduated with a Master's of Science from the University of Ottawa, specializing in motor control. Olivia is a clinical research assistant at the Canadian Concussion Centre and completed her master's in clinical neuroscience at King's College London. And I will let them take it away.
Hello, everyone. Thank you for coming to our presentation. Today, we will be talking about characterizing acute versus chronic concussion patients' profiles in Ontario. My name is Michaela Bubna, and I'm with the Hamilton Health Sciences, and
I'm Olivia Scott, and I'm at the Canadian Concussion Centre.
For a brief background, concussions are extremely common, as approximately 150,000 people in Ontario sustain one each year. Most patients who suffer from a concussion usually make a full recovery within days to weeks. However, about 10 to 20% of patients experience persistent symptoms. While studies looked at identifying which factors contribute to these persistent concussion symptoms, the literature remains scarce when comparing between acute and chronic concussion regarding patient demographics, symptomology, and injury-related factors. Thus, our group looked to assess whether acute and chronic concussion patients differ with respect to sex and a history of mental health disorders, prior concussion, headaches, and migraine, and also to explore the profiles of acute versus chronic concussion patients. We use data from cross-sectional surveys across many sites in Ontario, all listed here. For analysis, we defined acute concussion as being within 14 days of the concussion and chronic concussion as 90 days or greater.
So for our results, we found no significant differences between the acute and chronic concussion groups on our 4 variables of interest, which were sex, history of mental health conditions, number of previous concussions, and history of headache or migraine. And as you can see, most of the differences in proportion were within 5% between the acute and chronic groups. For our secondary and exploratory aim, we looked at differences in profiles between the acute and chronic groups, just comparing proportions. So for some of our variables, we found differences in proportion of greater than 20% between the 2 groups. So there was a larger proportion of patients in the acute group for age 20 to 29 and patients living in Toronto. And there was a larger proportion of patients in the chronic group for work status as disabled and patients who sustained their concussion in a transportation-related accident. So overall, some takeaways from our analysis: there were no significant differences between the acute and chronic groups for some previously identified risk factors for persistent symptoms of concussion, such as mental health conditions and history of headache and migraine. As expected, sex and concussion history did not differ between the acute and chronic groups, since these are risk factors for sustaining a concussion. In our exploratory analysis, we found that there were some differences between the groups for age, work status, concussion mechanism, and region. So future research with the expanding CONNECT data set may have the statistical power that is needed to elucidate the role of these variables in the development of persistent symptoms of concussion. And thank you to the Ontario Brain Institute and the Government of Ontario for supporting this work, as well as to the entire CONNECT executive team.